Welcome all of you to the beautiful platform of performance. First of all, I want to introduce myself. I am Dr. M. Rakesh Kumar, a physiotherapist by profession. Today, I brought some interesting thoughts about laser, which will help us to understand how beautifully it is changing our life and we don't ever think about it. Does we think how a mobile network had changed our life? Or an internet technology which brought us together into the universe of knowledge? Whatever the questions arising in our mind, we just ask somebody who is sitting very far away answering us. Similarly, laser technology is entering our life. Whether we are a normal civilian or a professional in the field of science, defense, medicine, entertainment, business, or any other field, day by day, laser is playing its part in our life and making it easy and accurate way towards life. I have a clinical experience of 12 years and successfully treated more than 8,500 cases. In 2009, I started my journey with a small physiotherapy clinic, as everybody do. Used physiotherapy devices and medical manual techniques to treat the patient whichever is required. In September 2011, I had started a new concept to run a full-fledged hospital of physiotherapy. The basic concept of this is to create a platform where physiotherapy can show its existence in all the three streams of medicine: the prevention techniques, treatment of injuries, and rehabilitation of disabled. In January 2019, developed a new world of laser therapy, starting with regenerating cartilage of knee joint, and named it Forward Physiotherapy and Knee Care Center. For everything, there is a vision behind. And here I am asking to myself, is it possible? There are many questions arising in my mind which don't allow me to take rest. Some of these cases which pushed me to go ahead to search some solutions as being shared on this webinar, like CP, cerebral palsy. The child suffering from the mental illness was my first milestone of success. Successfully treated 18 children. Now, happy to see them going to school with normal students and no depression at all. At this time, there was a question in my mind: if some part of brain is under permanent damage, then the treatment is possible or not. I still need lots of effort from all of us in the field of muscular dystrophy, delayed milestone, mental retardation, hydrocephalus, microcephaly, myelomyalgia, seal-like conditions. Burn contractures also put my focus. What will be the condition when a 16-year-old visit after burn post-operative contracture of shoulder joint, loss of axilla, elbow joint contracture, abdominal musculature contracture leading to a stooped posture. Many cases like this leaving a healthy and active life. Happy to see them as a IPS or an architect. Here the question was, does a fire damages only skin or also damages the nerves, arteries, vein, musculature, lymph nodes, etc.? A physiotherapist should take care of all the damages. Then crash injury. I can never forget a girl going to school, her right leg was crushed by a container truck, being operated by a Lazaros technique. Compression fracture of spine and spinal cord injury. Head injury with brain abscess, multiple fractures. All these cases made me salute my profession and its ability to use the sources of energy and knowledge of different medical complications for human well-being. On the screen, you are viewing a picture of a person who is suffering from avascular necrosis hip joint bilateral and PIVD together. So he was an unusual case. Like this, some unusual cases which developed the scope of physiotherapy, such as rehabilitation of a girl with complete brachial plexus injury, with complete motor as well as sensory loss of her left hand, and now she is a jewelry designer in Jaipur. Son of highly reputed doctor suffering from multiple sclerosis, completely bedridden, now able to walk and perform activities of daily living perfectly within 50 days of physiotherapy. A patient on dialysis suffering from renal dysfunction, suggested for transplantation and being treated using laser, received good results. Sports person with complete ACL ligament tear able to play basketball as national player and squat with almost 140 kg weight. Really surprising for me when he shared the video with me. A person suffering from PIVD and avascular necrosis, hip joint, to perform balance exercises and long running exercises too. A 80-year-old geologist suffering from inguinal hernia within a week is fine and happy. All these things are grateful to me. I appreciate the role of physiotherapy in osteoarthritis, hemiplegia, prolapsed intervertebral disc, ICU care, cardiac and respiratory illness, and bed sore, etc. I treated thousands of cases with myofascial pain syndrome with trigger points, ligament injuries, giving me the title of the healing hands. Thanks to all my clients who gave me a chance to help them in this crucial condition. A new tool to speed up the recovery rate and generate the accuracy in treatment is done by involvement of cold laser, that is LLLT, low level laser therapy. While selecting the laser device, many questions arise in our mind, such as, can it fulfill the criteria of physiotherapy of non-invasiveness? Can it be helpful to increase the scope of physiotherapy? Is it safe to apply or harmful to physiotherapists who will be in contact for long duration? Will patient accept physiotherapy treatment? Is it good enough to invest money in this technology? Is there any course available for laser therapy and many more? So, today I am sharing my experience why I selected and to add LLLT as a part of my successful journey as physiotherapist. There are some questions which put my focus to different aspect about laser. Is there any requirement of laser? My answer was yes, because there is shortage of time. People want to improve as quickly as possible and return to their job. Medicine avoiding tendency of people. People had developed a tendency to avoid medicines such as much as possible because of their side effects. Desire of healing as natural as possible without any scar mark or side effect, and want value for money. People ready to pay but demand the same quality of treatment to reduce pain, improve wound healing, and regain their functional capacity. How laser therapy is useful? Cold laser therapy is a modality used in physiotherapy. It delivers low level laser which does not produce any heating effect. A modality that creates optimal healing effects by improving circulation and bringing nutrition to the area which is injured or recovering. The light energy absorbs quickly from cold lasers and this reduces the healing time. This energy supercharges a cell that needs to heal and create a near instant effect to reduce pain, swelling, tightness. How can we know which laser modality is useful? There are few factors which affect our selection, which are the depth of treating surface or injured tissue. Let's take example of knee joint collateral ligament are closer to surface but ACL and PCLs are 3 to 5 centimeter deeper. Area to be treated. If it is a case of trapezitis, you have to treat a large area. And in case of tennis elbow, a point. So it matters in the field which probe is usable. How quickly the energy is being transferred. For example, a red laser device delivers 15 joules of energy into 15 joules of energy per square centimeter in approx 25 minutes, while infrared device delivers in 4 minutes, and far infrared delivers the same energy of 15 joules in 1 minute and 15 seconds. The cost of the device and paying capacity of the clients in living in rural, urban, or metro city. To solve this puzzle, I had to understand the laser, and I personally found it as an ocean of knowledge. Its uses, effects, and have infinite possibilities of development. Similar is the case of application of laser in the medical field. It is progressing day by day. What inspired me towards the application of cold laser? It is effect of increasing the regeneration power of cells, which plays the main role in wound healing and reducing pain and swelling and speed up the repair mechanism of the wounded tissue. Another quality is that it is effective on diabetic patients and it is safer in hypertensive patients also. Not just this, it is helpful in increasing the immune system, functioning on renal system, and respiratory systems also. There is another question how a laser can heal, which comes in everybody's mind. So, to understand this, I had made a small package. As we all know, laser device is a device which emits a light beam which can travel to a long distance. It is a source of energy. If it is been projected on any element, then it changes the motion of the electrons of that body. That is, moving to a higher orbit because of the energy they received by a projected laser. The similar is the process of emission of laser. The whole human body is made of proteins, carbohydrate, fatty acid, nucleic acid like compounds, which are combination of carbon, hydrogen, oxygen, nitrogen like elements and many microelements. I am showing some structure. First, we are looking at the fatty acid. You can see it is a combination of hydrogen, oxygen, and carbon dioxide in different structures, which represent different fatty acids. Carbohydrate. Glucose is the main example, and it is a structure you can see is C6H12O6. Okay, it is also a combination carbon, hydrogen, and oxygen. And we are moving to amino acids, which is the fundamental structure of every protein. Here, the amino group is NH2. So we can see the elements designed our body. Now moving to cellular level. At cellular level, cell membrane and mitochondria plays a significant role. First, we have to observe the changes that take place at cell membrane because at this level, the exchange of material between intercellular environment, which represents the requirement of cells, and their surrounding take place. Due to any pathological or accidental conditions, the semi-permeable property of the cell membrane changes. It means exchange of material does not take place at a proper rate, which is required for to heal. The cell membrane is made of phospholipid bilayer, which is a chain of elements. When these molecules receive faster and laser energy, it improves the exchange rate and required nutrition enters the cell. Inside the cell, there is another organelle called mitochondria, which plays an important role to respond to different energy levels. When an energy source is applied over a cell, then it fulfills the energy requirement of the cell membrane. So, it properly controls the movement of elements via various gate channels and receptor sites, and mitochondria will get suitable environment to react at it. When a laser light is delivered to a tissue via probe in contact mode with the surface of the skin, the light enters the mitochondria and is absorbed by chromophores and cytochrome C oxidase, which then increases its activity. As a result of this activity, three molecules are mostly affected, such as adenosine triphosphate (ATP). The main energy source for the majority of cellular functions increases the cell ability to fight infections and accelerates the healing process. Reactive oxygen species. It activates transcription factor which positively impacting cellular repair and healing. Nitric oxide, a potent vasodilator. increases circulation, decreases inflammation, and enhances the transport of oxygen and immune cells throughout the tissue. Mechanism of laser therapy, as you see on your screen, that a laser beam is been projected from outside the skin and it enters up to the level of cell and then mitochondria, and how it is affecting ATP, ROS, and NO. It produces a photomodulation in the target tissues, and it is being classified in four forms. That it has produces a thermal effect which increases the nerve conduction, increases the capillary dilatation, biochemical effects which it releases due to nitric oxide, increases ATP production, fibroblast migration, macrophage activity, keratinocyte activity, DNA and RNA synthesis is increased, increase in the enzyme production, and increase in SOD production. Then moving to bioelectric effect. The bioelectric effect increases the electromotive action acting on membrane bound ion channels, increases the intracellular and extracellular ion gradient changes. Bioenergetics, acupuncture meridian point stimulation means it is a complete package in itself. All these changes bring some clinical effects to reduce spasm, pain, increase circulation, improve flexibility and function, improve healing, reduce symptoms associated with osteoarthritis. To understand this process, certain criteria and techniques have been used in researches, such as light microscopy, to record the changes in normal and wounded fibroblast cells morphology, adenosine triphosphatase luminescence to evaluate mitochondrial activity, alkaline phosphatase activity assay test to record the cell proliferation action, lactic dehydrogenase activity assay to assess membrane integrity, Comet assay to understand percentage cytotoxicity and cell DNA damage. As you can see, I am showing clinical effects of low laser therapy at different systems. Increases angiogenesis and neovascularization. An increase in the oxygenated blood to the injured tissues accelerates the tissue healing. Collagen production. Increase in proper alignment and remodeling of the collagen reduces internal scar and formation and enhances the tissue elasticity. Muscle regeneration and muscle atrophy. Repair of damaged muscle fibers and activation of myogenic satellite cells lead to the regeneration of muscle tissues. Decrease in inflammation and edema. Increase in inflammatory mediators such as macrophage, neutrophils, and lymphocytes accelerates and resolves the inflammatory process. Increase in nerve regeneration, proliferation of growth factors promotes the neuronal sprouting and myelin formation for the optimal nerve recovery. Can be useful in Valerian degeneration. Cartilage production. Increase in chondrocyte and collagen production allows to improve cartilage deposition and joint function. Bone formation, proliferation of osteocytes and remodeling of bone extracellular matrix results in accelerated bone repair. All these things encouraged me to come. As I'm moving towards the wound healing, it has been completed in inflammatory phase, proliferative phase, maturation phase, which take inflammatory phase will take 4 to 6 days. Then proliferative phase take 4 to 24 days, and maturation phase can last from 21 days to 2 years depending upon the state of condition of the patient, whether it is a diabetic or the infectious, whatever the condition. How could we decide which type of laser should be useful to us? First, if we have to treat skin, epidermis, and dermis, then we can use the red laser. If we have to treat fat and muscles, then near infrared is sufficient. If we have to touch the bones, Then we have to take a red infrared. Yeah, far infrared, which is a combination of red plus infrared, overlapping over the two. Now I am giving you some indications of cold laser. Cold laser is useful in headache, tendinitis, arthritis, tennis and golfer's elbow, intercostal pain, hip joint, wounds, ankle sprain, plantar fasciitis, knee pain, ligament injuries, diabetic neuropathy, Achilles tendinitis, synovitis, sciatica, carpal tunnel syndrome, low back pain, rotator cuff, shoulder pain, neck arthritis, neck pain like conditions. So I think you all enjoyed it. Some important topics we will share in next webinar on this platform includes fundamentals of laser therapy, consist of history of invention of laser, characteristics of laser, property both optic, thermal or non-thermal, parameters of laser measurement, classification of laser as provided by state and ANSI and IEC, utility of laser in the medical field in detail. Our interest will increase as we move on the role of laser in the medical fields. Let's begin with the treatment of patient with hyperglycemia, that is diabetic mellitus. Role of in operation theater and in post-operative care units. Role of laser in conservative management of orthopedic conditions. Role of laser in pulmonary conditions. Role of laser in physiotherapy, giving it new heights. I will discuss all these topics in later webinars. Thank you. For more questions, you can email me at rakesh5183 Webinar can be discussed on website www.forwardphysiotherapy.co.in and WhatsApp me at 6260645815. Thank you so much for giving me this usable time.